Hello and welcome all to Dr. Shah's Holistic Health Diaries, your one-stop destination for all the latest cutting-edge health insights. My dear friends and folks, today we will be talking and shedding light on one of the most important healthcare topics which we often encounter and encompass during our busy clinical practice. That is, what are the early signs and symptoms of food poisoning? Yeah, you heard me right. We often encounter ourselves and find ourselves in this dreadful and devastating disease, the side effects of which can be quite challenging and daunting and can often land a patient into life-threatening emergencies. Therefore, we should be very well aware and we should be very well backed up with the knowledge that what are the immediate signs and what are the symptoms and what are the immediate repercussions if not taken into account. So we should be knowing the immediate home therapies, when to kickstart oral rehydration and electrolyte therapy, and when to flag off as patient with real emergencies to the nearest emergency centers to save lives. So today's video is very important because you should be knows the do's and the don'ts of this dreadful disease. So stay tuned, stay focused, and let's dive in to know more together and let's save those lives.
Microbial foodborne illness, also known as food poisoning, occurs commonly throughout the world and happens when you consume contaminated food, drinks, or water. Bacteria, viruses, or toxins are often the main culprits. The most common are Salmonella, Norovirus, hepatitis A virus, Listeria, and invariably E. coli, which is known to cause a foodborne illness called traveler's diarrhea. Symptoms can appear hours after you eat the contaminated food, or may not appear until days or weeks later. The most common symptoms and warning signs include nausea and vomiting, stomach pain and cramping, diarrhea, which may be watery or bloody, fever and chills, often associated with fatigue and weakness. Less commonly, neurologic symptoms develop, such as blurry vision, dizziness, or tingling in the arms. In some instances, the most life-threatening problems occur several days after the start of intestinal symptoms, and these can even include kidney failure, meningitis, arthritis, and paralysis, depending on which foodborne microbe you have been exposed to. You may feel unusually tired or weak due to dehydration and the toll food poisoning takes on your body. So, what should you do immediately? Number 1, the home remedy is to stay hydrated. Replace lost fluids with water or an electrolyte drink, or preferably use ORS. Number 2, rest, allow your body to recover. Number 3, one should be very vigilant in children and elderly patients, as they can lose fluid rapidly from vomiting or loose motions, which can quickly lead to dehydration and rapid worsening of symptoms. Seek immediate medical help and report to the nearest emergency if symptoms are severe, such as recurrent bloody loose stools, high fever, or non-stop projectile vomiting and disorientation. The healthcare provider will assess the severity of symptoms besides checking your vitals and will administer intravenous fluids to maintain electrolyte balance and may use antiemetics to stop vomiting. A sample of stool or blood can be sent to a laboratory to determine which microorganism is responsible for the symptoms, and in some cases intravenous antibiotics are necessary. Food poisoning can strike anyone, but recognizing the early signs can make all the difference. If you found this video helpful, hit the like button, share it with others, and don't forget to subscribe to Dr. Shah's Holistic Health Diaries for more life-saving health tips.